Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about endometriosis. So go ahead, subscribe, and let's get started. First, let us see the definition of endometriosis. Endometriosis is a chronic condition of the female reproductive system in which tissues similar to the inner lining of the uterus, called the endometrium, grows outside the uterus. These tissues are commonly found on the ovaries, fallopian tubes, and other pelvic organs. Even though they are outside the uterus, they still respond to hormonal changes during the menstrual cycle, which can lead to pain, inflammation, and sometimes infertility. Next, let us look at the incidence of endometriosis. This condition affects about 10 to 15% of women who are in their reproductive age. It is most commonly seen in women between the ages of 25 and 40 years. The chances of developing endometriosis may be higher in certain women, such as those who experience early menarche, which means starting menstruation at a younger age, women who have short menstrual cycles, and women who have not had children, which is known as nulliparity. Endometriosis is also considered one of the major causes of chronic pelvic pain and infertility in women. Next, let us see the common sites of endometriosis. The most common site is the ovaries. When endometriosis occurs in the ovaries, it can form cysts filled with old blood, which are often called chocolate cysts. Endometriosis can also occur in the fallopian tubes, which are the tubes that carry the egg from the ovary to the uterus. Another common site is the pelvic peritoneum, which is the thin lining that covers the pelvic organs. It can also affect the uterosacral ligaments, which help support the uterus, and the rectovaginal septum, which is the area between the rectum and the vagina. These areas are commonly involved and can contribute to pelvic pain and other symptoms. Next, let us look at the etiology or theories of endometriosis. One of the most widely accepted explanations is the retrograde menstruation theory, also known as Sampson's theory. According to this theory, during menstruation, some of the menstrual blood flows backward through the fallopian tubes into the pelvic cavity instead of leaving the body. This blood contains endometrial cells, which can attach to pelvic organs and start growing there. Another explanation is the coulombic metaplasia theory. According to this theory, certain cells in the pelvic lining, called peritoneal cells, can change or transform into endometrial-like cells. These transformed cells then grow outside the uterus and lead to endometriosis. Another theory explaining endometriosis is lymphatic or hematogenous spread. According to this theory, endometrial cells can travel through the blood vessels or lymphatic vessels and spread to different parts of the body. These cells can then attach and grow in other areas outside the uterus. Another possible cause is immune dysfunction. In this situation, the body's immune system is not able to recognize and remove the endometrial tissue that grows outside the uterus. Because of this inability to clear the ectopic or misplaced endometrial tissue, the cells continue to grow and lead to endometriosis. Next, let us understand the pathophysiology of endometriosis. In this condition, the endometrial tissue that grows outside the uterus still responds to the hormone estrogen, just like the normal uterine lining. Because of this hormonal response, the tissue undergoes cyclic changes during each menstrual cycle. This leads to repeated bleeding in those areas. Over time, this repeated bleeding causes inflammation and later fibrosis, which means the formation of thickened scar tissue. As a result, adhesions and scarring can develop between pelvic organs. These changes can lead to chronic pelvic pain and can also distort the normal structure of the pelvic organs. Next, let us see the clinical manifestations of endometriosis, especially the pain symptoms. One of the most common symptoms is dysmenorrhea, which means severe pain during menstruation. Women with endometriosis may also experience chronic pelvic pain, which is a continuous or long-term pain in the lower abdomen or pelvic area. Another symptom is dyspareunia, which means pain during sexual intercourse. Some women may also have dyschezia, which refers to pain during bowel movements. In addition, Lower back pain is also commonly reported in women with endometriosis. These pain symptoms can significantly affect daily activities and quality of life. Next, let us look at other clinical manifestations of endometriosis. Some women may experience menstrual abnormalities, such as menorrhagia, which means heavy menstrual bleeding, and irregular menstruation. Endometriosis can also cause reproductive problems. Many women may experience infertility or subfertility, which means difficulty in becoming pregnant. In addition to these, some women may have other symptoms such as fatigue and abdominal bloating. Depending on where the endometrial tissue is located, urinary or bowel symptoms may also occur. These symptoms can vary from person to person. Next, let us see how endometriosis is diagnosed. Diagnosis usually begins with clinical evaluation. The doctor first takes a detailed history of the patient, especially about menstrual symptoms and pelvic pain. After that, a pelvic examination is performed to check for tenderness, nodules, or any abnormalities in the pelvic organs. Further confirmation is done through investigations. Ultrasound is commonly used to detect ovarian endometriomas, which are cysts related to endometriosis. MRI can also be used to identify deep infiltrating endometriosis and to assess the extent of the disease. However, the gold standard for diagnosis is laparoscopy. In this procedure, a small camera is inserted into the abdomen to directly visualize the endometrial lesions, and a biopsy can also be taken for confirmation. Next, let us see the management of endometriosis. The treatment mainly depends on several factors, such as the severity of the disease, the age of the woman, the symptoms she experiences, and whether she wants to have children in the future. One approach is medical management. For pain relief, doctors often prescribe NSAIDs, which help reduce inflammation and relieve menstrual pain. Hormonal therapy is also commonly used. This includes combined oral contraceptive pills, which help regulate hormones and reduce the growth of endometrial tissue. Other medications such as progestins or danazol may also be used to suppress the activity of endometrial tissue and reduce symptoms. Next, let us look at the surgical management of endometriosis. Surgery may be considered when symptoms are severe or when medical treatment does not provide enough relief. One common procedure is laparoscopic excision or ablation. In this method, the surgeon removes or destroys the endometrial tissue using a minimally invasive laparoscopic procedure. Another procedure is adhesiolysis, which means surgically removing the adhesions or scar tissues that form between pelvic organs. In very severe cases, especially when the woman does not wish to have children in the future, hysterectomy may be considered. This involves the surgical removal of the uterus and is usually reserved for advanced cases. Finally, let us look at the complications of endometriosis. One common complication is chronic pelvic pain, which can persist for a long time and affect daily activities. Endometriosis can also lead to infertility, making it difficult for some women to become pregnant. Another complication is the formation of adhesions, where scar tissue causes pelvic organs to stick together. Because of ongoing pain and fertility problems, many women may experience psychological stress. These physical and emotional challenges can eventually reduce the overall quality of life. Now, let us look at the nursing management of endometriosis. Nurses play an important role in assessing and managing the patient's pain and helping the patient cope with the symptoms. Patient education is also very important. Nurses should explain the disease, its symptoms, and the available treatment options so that the patient can better understand her condition. Providing emotional and psychological support is essential because many women with endometriosis may experience stress or anxiety due to chronic pain or fertility problems. Nurses should also counsel patients about the importance of taking medications regularly and following the treatment plan. In addition, lifestyle guidance should be given. Patients can be encouraged to do regular exercise, practice stress reduction techniques, and follow a healthy diet to help improve their overall well-being. Here, let us look at the prevention and prognosis of endometriosis. At present, there is no definite way to completely prevent this condition. However, early diagnosis and proper treatment can help reduce symptoms and improve the patient's quality of life. It is also important to understand that endometriosis may recur even after treatment. Therefore, patients usually require regular and long-term follow-up to monitor their condition and manage symptoms effectively. At last, we will see the nursing diagnoses for endometriosis. First, acute pain related to pelvic inflammation and endometrial tissue growth outside the uterus, as evidenced by complaints of severe dysmenorrhea and pelvic pain. Second, chronic pain related to recurrent pelvic lesions and adhesions, as evidenced by persistent lower abdominal pain. Third, anxiety related to chronic illness, infertility concerns, and long-term treatment. Fourth, impaired comfort related to pelvic pain, dyspareunia, and menstrual discomfort. Thank you for watching this video. I hope this session was helpful for your exam preparation. If you found it useful, please like, comment, and share this video with your friends. Don't forget to subscribe to Learn with Professor Janula, and press the bell icon for more exam-oriented nursing videos.